Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Introducing, my name is Tina Ahada Molidia. Bachelor of Pharmacy study program is still at the University of Pekalongan. Currently, I'm a new semester 1 student. In this video, I will discuss about pharmacies. Before discussing it, I would like to tell you a little about the word pharmacist, namely is pharmacy. Pharmacy is a science that studies all the intricacies of medicine. Pharmacy is the application of three fields of science, namely medicine, chemistry, and biology. The scope of pharmaceutical science does not only focus on the exact science, but also on social science such as pharmacy management and pharmacoeconomics. Pharmacist. What is a pharmacist? When you hear the word pharmacist, what comes to your mind may be someone who is good at dispensing drugs and can tell you what kind of medicines to cure your disease. In fact, the pharmacist's job is quite complex and requires competence that cannot be underestimated. Pharmacies in Indonesia are marked by the title APT. In front of the rightful name, in pharmaceutical work only pharmacists can be responsible for all pharmaceutical work carried out. Roles and responsible: prepare, mix, infect, and dispense drugs, keep accurate records and stock taking of medicines, provide information and advice about medication, health problems, and lifestyle choices, supervise and inspect the work of other pharmacy staff, oversupply such as blood pressure, glucose, and cholesterol tests, design and implement policies, procedure, and budget for the drugs as used throughout the organizations, design and conduct clinical trials. Pharmacy's job prospect: Number 1, pharmaceutical industry. Number 2, hospital pharmacy. Number 3, pharmacy. Number 4, pharmacy service is government. Number 5, pharmaceutical wholesaler or PBF. Number 6, community pharmacy. Pharmacists must be able to explain about drugs that are useful to patients because they know about number 1, how to use and take medicines. Number 2, side effects that occur when the drug is used. Number 3, stability of the drug under various conditions. Number 4, toxicity and dosage of drugs used. Basically, both drugs sold in the market and those prescribed by doctors have their respective classes. To more clearly know the difference between OTC drugs and prescription drugs, you must first understand the classes of drugs on the market. Over-the-counter drugs are drugs that are sold freely in the market and can be purchased without a doctor's prescriptions. A special mark on the packaging and label of over-the-counter drugs is a green circle with a green border. Recipe is a written request from a doctor, dentist, doctor animals that are licensed under laws and regulations that apply to the managing pharmacist, pharmacy to prepare and or make mix and dispense medication to the patients. Difference of OTC and prescription drugs. Number 1. Drugs with a black circle logo and a green background include over-the-counter drugs that can be obtained without a prescription. Number 2. Drugs with a black circle logo and a blue background are limited to over-the-counter drugs, usually accompanied by a warning. Number 3. Drugs with a black circle logo and a red background include strong drugs that can be only obtained with a doctor's prescriptions. Number 4. OTC drugs can be given to many people without special specification, while prescription drugs are given specifically for one person based on a doctor diagnosis. Number 5. OTC drugs are quite safe and have minimal side effects, while the side effects of prescription drugs tend to be larger and require a prescription. The classes of drugs. Number 1. Black circle on a green background. Drugs with this logo include over-the-counter drugs that can be obtained without a doctor's prescription and can be purchased at drugstore, retailers, and pharmacies. Example, paracetamol, antacid, etc. Number 2. Black circle on a blue background. Drugs with this logo include limited over-the-counter drugs. This means that this drug can be obtained without a doctor's prescriptions and can be purchased at stalls, shops, and pharmacies. Thus, must observe certain rules. Example, dimenhydrinate, povidone iodine, etc. Usually, drugs that fall into this group are accompanied by a warning that is given a black background in the words. P number 1. Watch out, hard drugs. Read the rules of use. P number 2. Watch out, potent drug. Just to gargle, don't swallow. P number 3. Watch out, potent drug. For external use only. P number 4. Watch out, herb medicine. Only for burns. P number 5. Watch out, potent drugs, not to be taken internally. P number 6. Watch out, potent drugs, hemorrhoid medicine, do not swallow. Black circle on a red background and letter K in black. Drugs with this logo are hard drugs. These drugs are not sold over the counter, must be obtained with a doctor's prescription, and observe certain rules. Example, amoxicillin, captopril, etc. Number 4. Red circle with a white background, a red cross in the center. Drugs with this logo are psychotropic or narcotics. Obtaining it must be with a doctor's prescriptions, including the type of hard drugs, and is not sold over the counter. Pharmacists who are given the right to sell are also required to report the amount of type. Example, codeine. Number 5. The black circle says herbal medicines. Medicines with this logo are included in the herbal medicine group. Can be obtained at drugstore, stalls, and pharmacies. Example, tolak angin, laxing, etc. That's all for me. I hope the material I confused is usable. If there is a mistake, I apologize. Wassalamualaikum warahmatullahi wabarakatuh. Goodbye. Thank you, everyone.